Good morning. My name is Samara Andrade. I am Senior Director in Global Programs at Site Life, headquartered here in Seattle, Washington. I'm here today to talk about my WomenLift Health project, advancing gender equity in eye care in low and middle income countries. I spent the last 15 years working in humanitarian and development contexts at the intersectionality between health, security, and gender equity. More than 10 of those years has been working with the United Nations in various countries, as well as with nonprofits and social enterprise organizations. When we think about global health, we often think about big disease areas, and often vision is overlooked. And yet, sight loss can affect the entire trajectory of a person's life, their family, their community, and even a country's GDP. We know that women and girls are just as vulnerable as men and boys to eye injury and disease, but they're less likely to get the eye care that's needed to manage, save, or restore their sight. Studies in India show us that much of this inequity is rooted in gender bias and unequal access to health care. We also know that the majority of people experiencing vision loss and low vision live in low and middle income countries, disproportionately affecting women. In addition to those access to care areas, women face unique challenges in entering, advancing, and sustaining positions in the eye healthcare space, getting training and speaking opportunities at national and regional global levels. Making measurable progress on integrating eye health into primary healthcare services and taking a gender equitable approach to care is rooted and deeply connected with the SDGs 5, 10, and 3, as well as the recent World Health Assembly resolution passed on integrated people-centered eye care services. My project is looking at how can we support low and middle income countries, specifically Ministry of Health, in making measurable progress against these commitments through 3 questions. How can we strengthen primary eye healthcare systems for last mile communities and reduce barriers in access to care for women and girls? Second, how can the sector effectively make progress on integrated primary eye care services when funders often select silos to fund? How can we advance and support gender equity among healthcare providers, promoting and supporting women's advancement in the field is the third area. The components of my project are fourfold. The first is the gender strategy for our organization's global programs in low and middle income countries. The second is understanding the data and analytics of our programs. Where have we been, but also being able to have a window into regularly assessing and looking at where we are against the key outcomes that we set for our gender strategy and the benchmarks that we've set. Finally, this helps us be able to tell our story to social impact funders, but more importantly, to have that accountability internally in the organization. The third area is the launch of a 3-year project in Ethiopia that takes a gender transformative approach from beginning, design through implementation and evaluation, and focuses on integrating eye care into primary health care in rural communities. Finally, consolidating lessons learned and best practices and publishing a case study. Key results thus far. We have a draft gender strategy for Slight Life that is centered around these 5 outcomes. And one of the key things we've been able to do in this last year is to get organizational commitment and support for dedicating human resources to be able to begin to make measurable work on this strategy, resources from program, IT, and monitoring and evaluation. This has enabled us to disaggregate data from 2 of our global programs from the time of inception until now, which includes 75,000 patient records, as well as all of our training data, and to conduct a desk review on funding. In terms of the project in Ethiopia, a few of the things to call out is gender transformative approaches to our curricula with community health care workers and primary eye care providers. It's enabled us to elevate core issues into advocacy and policy dialogues around gender equity issues in eye care, to be able to develop a shared understanding with Ministry of Health and eye care actors on the need for integrated primary eye care, and to advocate for the inclusion of gender equity and integrated primary care in the next 5-year national strategic eye care strategy. We've also been able to provide access to care for over 2 million people with training of eye care providers. Key things as I look forward and recommendations for the future. My number one is Gender Up Grants. I'm very passionate about this. I see the need for advocating with foundations and funders to develop what I call Gender Up Grants mechanisms, specifically targeting global health organizations to support them in reaching minimum targets around gender equity. Within our organization, capacity development, year 2 of Ethiopia project with a focus to expand care to more than 4 million individuals. Continuing to leverage opportunities at the global level for advocating for integrating eye care within primary care, continuing to lift up women from the space in low and middle income countries, giving them opportunity for voice. This project's been an incredible opportunity for me to not only leverage my skill set, but to grow and to think about my leadership and the work I do differently, which has strengthened my voice and my resilience, helping me lead from an authentic place. It's also helped me to center and elevate voices of Ethiopian women in the eye healthcare sector, centering inclusivity and inspiring action. I want to thank Women Lift Health and all of the funders that make this program possible.